Okay, it is noon, and I will go ahead and get started. Thank you all for attending the inaugural PharmCAT Family Chat hosted by our PharmCAT Family Committee. This alumni speaker series was developed to have our alumni share what their career has been since graduation, where their degree has taken them, and we wanted to invite our alumni to come back and share this with our students in hopes to show our students that there is much more to your pharmacy degree than you might think.
Mhm.
So with that, I have a couple of housekeeping items. If you have any questions, please send them to me, Erica Grasse, in the chat, and we will share those questions at the end. Um, and if your computers or if you can mute your computers, if they're not already muted, that would be wonderful. And I am going to introduce our speaker. This is Janice Friedman. She began her career at CVS Caremark in 2000 as a retail pharmacy manager. In 2002, she changed her role to clinical advisor in clinical account services. In 2010, spent her time in clinical sales operations and returned to serve on the Aetna business unit beginning in 2011. In clinical sales operations, she had the opportunity to serve as a resource to sales and account services and represent this department on enterprise-wide committees and work groups. Her role in the Aetna business evolved from serving as a clinical advisor to the commercial health plan to being an integral part of the integration activities when CVS Health acquired Aetna. In her current role, she supports multiple internal teams from formulary to prior authorization operations to compliance. Janice acts as a drug information and marketplace information resource. Dr. Friedman has more than 20 years of experience in pharmacy, ranging from home health and retail pharmacy to pharmacy benefit management. As the director of RPX, she was dedicated to managing the pharmacy benefit for the United Food and Commercial Workers Midwest Health Benefits Fund. There, she was responsible for the development and direction of the pharmacy program. Dr. Friedman earned her Bachelor of Science degree in pharmacy from the University of Arizona, her Master of Business Administration degree with a concentration in healthcare administration from Loyola University Graduate School of Business in Chicago, and then proceeded to continue her education and get her doctorate of pharmacy degree from the University of Florida. She holds a certified employee benefits specialist designation and is licensed as a pharmacist in the state of Arizona. Dr. Friedman, I want to welcome you to our first PharmCAT Family Chat. And we really look forward to hearing about where your pharmacy degree has taken you.
All right, great. Thanks so much, Erica. Happy to be here and happy to give back and share with the students maybe a little bit broader perspective to your point about what's out there for them once they complete their degree. So very brief agenda, why pharmacy, my education and career path, and my landing in managed care. So why I chose a career in pharmacy really just happened by chance. I was studying to be an art teacher with a French major and really had little exposure to any other careers other than teaching, as both my older sisters were teachers. As I looked forward to job prospects, they weren't very good in the core subjects. And then, as it happened, I had two prospective brother-in-laws in pharmacy school. So my mom said, "What about pharmacy?" Well, one brother-in-law was very bright. And I didn't think that I was up to that challenge. But the other brother-in-law was downstairs making out with my sister the night before exams. And I thought, well, there's this spectrum there. I can do this. I can do this. So then with my desire to move out of Chicago and away from my parents, I followed my oldest sister to Phoenix and made U of A my pharmacy school of choice. So I'll spend a little time here on my education and career path. So my U of A path actually had a little bit of a rocky start as I pivoted away from education to pharmacy. And I basically had to start from scratch. When I applied to pharmacy school, unbeknownst to me, the U of A College of Pharmacy was having some accreditation issues. So to meet the accreditation standards, and this was way back, 1976, they had to decrease the class size from 98 to 55, and they managed this by only accepting Arizona residents, which I was not one at the time. So this delayed me for about a year. But it worked out for the best. I was able to take some of the non-professional classes, such as physiology, for that 1 year, kind of an interim year, before actually starting into the professional years. Truth be told, I was an alternate for the class of 1980. And my Jewish mother sent a letter to Dean Cole and to Senator Goldwater at the time to consider my admission to pharmacy school and laid out her case. Now, Dean Cole gave quite a chuckle, and he teased me about it through my professional years. And obviously, my mother's letter didn't have any weight, but I did get in. So moving on in the course of my professional career, I sometimes found myself with a little too much time on my hands. So I would pursue some educational endeavor. So you can see here, I started with a certified employee benefits specialist. So that really is it's comprised of a 10-course program relating to the insurance industry. So I had a little bit of law, finance, and pharmacy in there. Next, I decided on an MBA versus a PharmD. I was really intimidated by getting a PharmD degree. I had been out of school for quite a while and felt that I was a little bit lacking in my clinical skills. So I figured the MBA would be easier, so I tackled that. And then later, there was really nothing to stop me from pursuing my PharmD. So I found a distance learning program through the University of Florida. It was a little bit of a challenge because the experiential training at most schools, you do have to take off of your full-time professional career. And that wasn't going to work for me. So the University of Florida's program of distance learning had 36 experiential sessions. They're independently fulfilled, they're at your own pace, and there are certain parameters that had to be met and corresponding with each module, which was condition specific, but was very doable. It was a 3-year program, and obviously I completed that, and that was back in 2010. For my career path, which ran in tandem, if you will. So retail was the first obvious choice. I did my internship at Mead's Pharmacy over at Prince and Floyd Wells. And I really wasn't aware of any other opportunities outside of hospital and academia. So not really fulfilled at retail. I had an opportunity for a job at a home health agency, so home infusion. And that kind of fell in my lap. A fellow pharmacist friend was the manager at a site. So it was an infant industry at the time, and it came with a very long commute and activities being a little bit hospital-like. I wasn't very comfortable with that. And so I would say I burned out pretty quickly, working long hours, being on call, and having a long drive to and from the office. So I was only there for about 18 months. I considered going back to retail. That's really what I knew and where I felt comfortable. But again, really by chance, I found a job posting for a union fund, so the UFCW, and seeking a pharmacist to manage their pharmacy benefits. Again, getting into the early years of this industry, I don't think my boss really knew what he envisioned for my role. So kind of had to make the job my own and make the job activities as I went along. So this job was very different than anything I ever expected in pharmacy. It was 9 to 5, Monday through Friday, in an office, no dispensing. However, I realized, and I was there for quite a while, developing that program, learning the industry, really looking at pharmacy claims as they come through and making sure that they're paid appropriately. So after some time, I realized that I was underpaid. Speaking to a couple of colleagues, my next door neighbor at the time was an HR manager at Blue Cross Blue Shield Association. He did a survey check on my role, and I was underpaid. We went to my boss, and it took a lot of strength, but I felt I had the data to support me. He did give me a raise, but not where I felt I should be. So I kind of lost my passion for my work and didn't quite feel appreciated. So started looking for other opportunities. I realized I was in the middle of my MBA degree. And so I went back to retail. I went back part-time so that I could finish up my MBA and pursue a job in pharmacy benefits. So upon graduation from my PharmD, I networked, went to an organization, Academy of Managed Care Pharmacists, and networked at that meeting and other people that I had met through pharmacy school earlier on, and sent my resume out to many. And it did find its way onto someone's desk, which led me to my current job. And just as a blast from the past, here is my, I know you think I'm crazy that I still have this in my drawer, but this is my acceptance to U of A College of Pharmacy for the fall semester of 77-78. So I will segue here onto my current career. So I work for CVS Health. I've been with the company 20 years now. CVS Health is comprised of a variety of divisions, some of which you probably know. CVS Pharmacy, of course, Aetna Insurance Company, which we just acquired a couple of years ago. Caremark, which is where I work, which is the pharmacy benefits management, also termed managed care. There's our OmniCare division. That is those are the pharmacies and pharmacists that support long-term health, so nursing homes. We have our Quorum division, which is home infusion, and Minute Clinic, which again, you're probably very familiar with, which are retail clinics with nurse practitioners or physician assistants. So we have these many divisions in CVS Health as we grew from a retail pharmacy entity to we call ourselves a healthcare company. We are a category of one. There's no other company out there that has all the variety of offerings that we have. And that includes managed care pharmacy, which is the Caremark division. And I'll focus there in what I do and my role. So think about when you are, if you're in the retail pharmacy setting, think about when you're processing a prescription. Where does that claim actually go? What happens in the seconds that information goes to the insurance company, gets processed, and you get a response. It's really pretty fast. Who's paying for that? And that's where Caremark comes in. So I'm going to take first a broader view of the industry. I'm not sure what you get exposed to in regards to managed care pharmacy in your training. So I thought it might be worthwhile to bring it here. So what is managed care pharmacy? It's the practice of developing and applying evidence-based medication use strategies that enhance member and population health outcomes while optimizing healthcare resources. Managed care pharmacy organizations such as Caremark cover populations of people. Pharmacists in managed care pharmacy have the ability to impact the care of millions of members. So the bottom line is really we're trying to ensure the right therapy, the right time for the right patient, and really for the right price, both for the member and for the ultimate payer, who could be their employer or it's the insurance company. So the view is more of a population health versus one-on-one, and while making overall healthcare less expensive. So where can a managed care pharmacist work? There are endless possibilities. So health plans, Cigna, Aetna, they have pharmacists that work in their areas in a variety of roles. Pharmacy benefits management, pharmaceutical industry, specialty pharmacy, hospital, academia, or consulting firms. So to dive in a little bit deeper here, so the pharmacist's role in managed care, and I picked three of the buckets that are most common. So health insurance plans like an Aetna or Cigna, pharmacy benefits management such as Caremark or Optum, and pharmaceutical industry, which can be any of the manufacturers out there. So prescription benefit plan design under the health insurance plans could include formulary plan design. So what drugs require prior authorization, what drugs might be covered or not covered. Pharmacy network, which pharmacies are enrolled and can process claims for you. Utilization management, which is prior author step therapy. Member cost share, and use of generic drugs. Utilization management is also, so those are additional limitations placed on formulary medications to help reduce improper utilization of medications. An example of this might be a migraine medication. Where someone has episodic migraines, there's no need really for them to have 30 tablets for a 30-day supply. They may never use them. They may use them in a 2-year span of time. So why not just give the member, the patient, the amount that they would actually need within a month's time? And so that would be an appropriate quantity limit. Formulary management would entail the intent to optimize patient care and therapy management. So you as a pharmacist would help to evaluate new therapies and existing standards of care. Developing criteria for coverage using evidence-based medicine, and reflecting your judgment in sharing your judgment with the medical and other pharmacy staff, and encouraging providers and to prescribe cost-effective treatments. Pharmacists can also be engaged in a P&T committee, so pharmacy and therapeutics. As you know, these are also, there are these committees in hospitals as well. Pharmacists often lead pharmacy and therapeutics committees by serving as the medication experts in evaluating the evidence of new drug therapies. And the P&T committees are often multidisciplinary, featuring pharmacists, physicians, and other providers. The clinical program development, pharmacists play a critical role here with the development and completion of clinical programs aimed at enhancing patient care. So programs that might encourage adherence to their medications, telling them how important it is to stay on those medications for their overall improved health care. And then we have business management as well, where pharmacists can play a variety of non-clinical roles in managed care organizations. So that could be rebate contract negotiations and establishing retail rates between network pharmacies and third-party payers. So in my particular role, my title is Senior Clinical Advisor. I'm technically on the sales and account services team. I'm assigned a client. I'm in our health plan segment, so I am responsible from a clinical perspective to a client, for a client that is in San Diego. They're a health plan. And I review prescription claims. I review with them where they're spending their money, how we can help to control utilization of high-cost drugs in an appropriate way. So next. So there are pros and cons to a managed care career, and I actually took this, plagiarizing from one of our pharmacy residents that we have. He put this together. So advantages, it really affords unique career opportunities. Also at CBS Caremark, so the Caremark division, we have pharmacists all over this company. Our president and CEO, who just retired, was a pharmacist, is a pharmacist. We have people in my role. We have people who support the P&T committee. We have people who support the formulary. We have people who are responsible for clinical programs. We also have folks that are responsible for reviewing compliance matters. Certain states or the federal government may come up with restrictions around what you have to cover or not cover. So there's a pharmacist role there as well. So I'm sorry, back to our advantages. So affording unique career options, a work-life balance. My work life is pretty much, I would say, sort of Monday through Friday. I actually have been working at home for about 15 years now. So there's some flexibility in between conference calls to do things that are more of a personal nature as long as my work gets done. Work from home opportunities for travel, which could be a positive or a negative. Flexible schedule, typically Monday through Friday work week, and an opportunity to use a mix of your business and clinical knowledge. Disadvantages, again, depends on your perspective. So presentation heavy, whether it be creating something or actually presenting to your client. Less structured role. So there's a lot of freedom in what I do. Some is clearly structured, obviously, quarterly meetings with my client, conference calls, answering client questions via email, but it is less structured. So if I have a time during my day, I can actually dig in and really dig into more clinical knowledge and to see again where my clients are spending their money, where I can help them out, where the company here can help them out. Frequent travel and depth of use of clinical knowledge. This varies. I will admittedly say my clinical knowledge is not very strong in this day and age and in this role. It's not really required of me. If I want to use more of my clinical knowledge, if I wanted to get more in depth, there are other roles in the company that would be available to me so that I could fulfill those needs. And lastly, I'm going to touch on what's unfortunately in the forefront of our lives these days is COVID-19. So the impact on managed care. So we really have a role in the current pandemic as pharmacists, no matter what practice setting we're in. And in my role, making sure that patients have access to their medications. So from our CVS health perspective, offering delivery for no charge in most locations. There's some restrictions, mail order. And then on the flip side, making sure there's no hoarding by implementing quantity limits on certain medications. I'm sure you read and heard and know hydroxychloroquine in the early days of the pandemic. There was positive news about taking that medication. And so we wanted to make sure that people who had lupus that might be taking this medication maintenance for long term had their drug while being able to fulfill maybe pandemic related prescriptions, but limiting it unless you really had that need. So I am going to pause there, and kind of in closing here, you can plan your life and your career, have an idea, a vision of what you want to do and where you want to go, but you really don't know what's going to happen along the way. There are twists and turns in life, and I'm sure whatever path you choose will work out to your benefit. So I know I'm going to answer some questions. Hopefully you have some from Erica. And my email, I will be sharing with Erica my presentation, and my email address is there. So please feel free to reach out if you have any other questions after this session. So Erica, back to you.
Thank you. I do have a few questions for you. One is, do you feel your MBA has helped you in your career?
I do. I would say the pharmacy degree is, again, my own perspective, but I think the pharmacy degree is worth much more. The MBA is kind of an icing on the cake. When I went back to school back to school for the MBA, I had to laugh at myself because I looked around and I said, there are so many careers out there. All I was focused on, from pharmacy degree till that day was pharmacy. I never thought about other opportunities. So it will probably broaden your opportunities out there.
What advice would you give to our soon-to-be graduates about how they can build a fulfilling career?
It's really up to you. I would say start where you feel most comfortable. Do a little, because I'm sure, as all of us wanted to do as soon as we graduated, was to get out there and make some money. But to start out with what you really feel comfortable with and have a passion for, and give yourself a little bit of time to network, whether it be through the college with alumni, or other networking opportunities you might have if there's family members or others, to see what's out there as to where you might like to end up. As I look back, I'm very happy that I had the different opportunities in different practice sites. That gave me an opportunity to see what really fit for me and what didn't fit for me.
So would you, how do I want to ask this question based on that? Do you feel you've missed out on any sort of other area in the pharmacy career? Like you were in retail pharmacy and you were, filling prescriptions and that kind of thing.
No, I don't think I did. When I started out, I really thought that I would always be in retail pharmacy. I think that I think I just wanted more, somewhere innately that I wanted more than that. I did enjoy it. Being out of retail and going back was uncomfortable for me, which I thought was very odd. And even in the early days of my career with Caremark, I did stay working in a retail pharmacy for a few days a month, a few hours a month, I should say, because I never wanted to feel uncomfortable in the pharmacy. I thought that was so weird. I'm a pharmacist, I'm licensed, I should feel good here. But things had changed over years where I wasn't as satisfied there, because patients would, and I'd be interested to know what the students feel. It was a little awkward for me, of course, with internet growing during my career, where a patient comes in and I felt sometimes they knew more than I did. And I do not like that feeling. So one would have to decide, really keep up on your clinical skills if you're going to stay in retail or whatever setting. Just challenge yourself to really keep up, so that you're comfortable.
That's great. What is your favorite thing about your work?
I think kind of the detective work of looking to see where monies are being spent inappropriately. I'm not sure if some of you probably not remember back with compound prescriptions. There are certain egregious pharmacies that kind of found a loophole in the payment mechanism. And so they would fill prescriptions for thousands of dollars, prescriptions that maybe marginally would have worked, topical products. Still to this day, some of those pharmacies are trying to submit claims for, let's say, a Pensay diclofenac cream. It is now available over the counter, but I would see claims for a couple $1,000, $2,000, $3,000. That makes no sense. $2,000, $3,000 on some medication that's life-threatening, absolutely, no question. But on a topical cream, no. So I'm a strong proponent of there are only so many dollars to go around, and we need to spend in healthcare, probably everywhere, but in healthcare in particular, we need to spend them wisely and where they're going to have the most benefit. So kind of the fun part for me is if I can find where dollars are being spent where they kind of shouldn't be, then that's a good opportunity, and it's kind of fun.
Great. I've got two more real quick questions, and these can be into one question. What type of person would do well in a managed care position, and with what personality or skills?
I think the person who would do well is someone who is very self-motivated. The job is not, it's not black and white. You go in, you know what you do, and you leave. So there's a lot of flexibility there in what you do with your client and what you do in your role. Some roles may be a little bit more black and white. You would need to be confident and to exude that confident, maybe if you're not exactly feeling it inside, but to show that face. Your presentation skills, your Excel skills, there's a lot of data, and the better you are with Excel, even though it's not a core competency, I think it helps you along the way. Your written skills are very important. That's probably anywhere in pharmacy. If you're, there's a lot of writing, whether it be to a client via an email or in other roles in the company where you might be writing a drug monograph or a clinical criteria for a prior authorization. Your writing skills have to be really good.
Great. That is the end of our questions. I want to thank you so much for doing this for our students and our faculty. And I have a gift that I'll give this to you once we, oh, can you see it? That we have lunch.
Thank you.
It's a mortar and pestle monogrammed, a logo, and like you probably don't have enough. Where is it? Here is a tumbler with the color.
Oh, great.
So
That's great. Thank you.
you are so welcome. You
Thank you.
did a great job, and it was really interesting to learn more about what a pharmacy degree can do beyond, filling prescriptions at either, a retail or a hospital. So thank you all for attending. Our next PharmCAT Family Chat will be March 11th with alum Bill Jones. It'll be at noon again. And so hopefully you all will schedule that in and join us for next month's PharmCAT Family Chat. Thank you again.
Thank you. Bye,
Bye.
everyone.